final panelist is Adam Schneider. He is coordinator of community relations and healthcare for the homeless, where he works on state and local public policy and community initiatives related to issues of health and homelessness. Prior to working at HCH, Adam was a case manager for people experiencing homelessness in Baltimore City. He has pursued graduate studies at Johns Hopkins University and the University of Maryland School of Social Work. In addition to his work in healthcare for the homeless, Adam teaches courses on philosophy, ethics, and public policies at several areas colleges.
I think before understanding how to engage in advocacy and direct service effectively, a question to ask is why. And I think that there are a couple of reasons why that's particularly important, and a couple of them come from the comments that have already been shared here in the audience. There is, in this society that we've created, a really strange sort of phenomenon, right? We were talking earlier about the fact that 1 in 6 Americans live in poverty. The number of people, 50 million, that are uninsured, twice that number at least are underinsured. The number of people who are experiencing homelessness, the wars that continue, the mass incarceration that we have created in the society. And the question, I think, that my esteemed teacher, Dr. Brakey, asked was, well, how do we permit this to happen? Right? It's not just about creating policies, but why do we permit these policies to exist? Why do we permit the phenomena to persist? And I think that it's because we're extremely disconnected from one another. We're extremely alienated from one another. We've lost really the sense of community that we once had, and that is essential to who we are. We are incredibly social beings, it seems to me, and we're so desperate to be social that Facebook has become something that almost everybody is on, right? People are talking to each other and are friends with people that they've never met, that they never will meet, and don't have any real deep relationships there, but they want to have some sort of relationship. Even more shallow than that, I mean, consider the amount of energy that people put in and care that people have for celebrities when they walk through the checkout line and care what's happening between Jennifer Aniston and Brad Pitt and Angelina Jolie, right? I mean, people put real energy into following this because we're social beings, because we want to care about the community and the people that are around us. Well, the system that we've created that creates things like poverty, that creates things like homelessness, that creates things like war and mass incarceration is not divine, right? It's something that we've created. And it's like Frankenstein's monster, right? It's this thing that we've created that now controls us, and that we feel like we can't do anything to address. But we can. And one of the things that Healthcare for the Homeless has done is to integrate advocacy and direct service. So we provide a great deal of health services, and during the networking, I can tell you all more about that. But we also engage in advocacy work at the local, state, and federal level. We engage in it not only with a certain small number of staff who do it, spend a lot of their time engaged in advocacy work, but we also engage our staff in it, and we also engage clients and other people who are or who have experienced homelessness in it. And the reason for doing that is not only because the services are insufficient to addressing the underlying problems. And if anybody doubts that, you should look at the tremendous growth in the organizations and the individuals engaged in doing service. Healthcare for the Homeless has grown substantially over the past 25 years. Our Daily Bread, the shelters in the county have grown substantially. The city has a 24-hour shelter But the services provide a way to engage people and to understand what's really going on, right? If we're going to address the fundamental issue, right, this fundamental issue of alienation that allows us to tolerate being disconnected. So disconnected that when people walk down the street and they see somebody who's in a desperate situation asking for help, sometimes they'll walk right by and not even acknowledge the existence of another person. They'll cross the street in some cases. That is profound in how alienated we are, that we can see another human being and entirely disregard them as a person. The only way to confront that, it seems to me, is by engaging those folks to meet their needs directly, but then engaging together to try to change the systems, to try to change consciousness, right? Because consciousness isn't just a container that we have, right? Consciousness is develops as an interplay between ourselves and the world. And the world that we live in really impacts the way that we see it. And so, as long as we see it as natural for some people to be destitute, for some people to lose their jobs, and then lose their health insurance, and then lose their homes, as long as we see that as something that's natural, we're never going to be able to solve the problems. So what we really need to do is we need a revolution in our society. We need a political, economic, and social revolution. We also need a revolution in our way of thinking if we're going to address that. And I think that, as other panelists have said, that really starts with understanding that we are in community. And I should say that homeless service providers are typically very bad at this. And the reason that, or as evidence of that, homeless service providers often talk about making our clients self-sufficient, right? You hear politicians say that, you hear homeless service providers say, what we need is to make our clients self-sufficient. Milton Friedman, someone with whom I don't share a whole lot of political views, but Milton Friedman, you remember probably famously on TV, pulled out a pencil and said, nobody can create this, right? The complication, the sort of integrated nature of creating a pencil, a ubiquitous object, has become so vast that nobody has the capacity to do this. We are not self-sufficient, none of us. I mean, I drove here in a vehicle that was created by other people. The materials were extracted from the ground from other people. The gasoline that ran it was pulled from the ground and then refined. The food that we are all eating was not made by us. The coffee wasn't picked. The roads were not paved by us, right? We are part of a tremendously interdependent community. And if we can move away from this idea that what we want is to be self-sufficient, and rather what we want is to build communities where each of us have the types of supports that we need to flourish in the ways and to find meaning in the ways and find purpose in the ways that make us shine, then I think we're going to really be looking at not only the policies but the social causes of those policies in new and in different ways. Justice doesn't exist individually, right? Justice, to quote, right, we want justice to roll down like waters, but justice is not something that's found individually. Justice is something that's only found communally, and covenants are only made communally. We are social beings, and we need to foster that, it seems to me, as much as anything else, and that's why engaging in both service and advocacy is so important.